Welcome. Today we're going to discuss about mental health, addiction, and trauma, which relate to many of us. We will discuss it with Eric. Eric Fisher is a certified counselor with experience treating addiction, trauma, depression, and additional mental health concern. Before we delve into it, support us by clicking the subscribe button below. Welcome, Eric. What do you see as the martial arts concepts that intersect with addiction recovery and mental health treatment?
Thanks, Willem, for asking that. I would say that there are a few martial arts concepts that intersect. One of them would be respect or self-respect and respect for other people in my life, because when I'm doing martial arts, I need to have respect for other people that I'm training with. And that's involving their boundaries, that's involving their sense of safety, that's involving emotional safety as well for them. And so that's one piece, but there's also the sense of balance that intersects with martial arts and mental health as well. So that could mean learning balance when it comes to different martial arts techniques or different stances with martial arts. Same thing when it comes to mental health and also addiction treatment. Somebody has to learn the balance between themselves and other people, their sense of self with other people, and also the balance between, let's say, doing a lot of things, but also being able just to be and be still and not feel like I have to do a lot. So being and doing, or binging and restricting. So not binging on maybe food, but neither am I restricting myself with food, or not not binging on maybe spirituality, but not restricting myself on spirituality. Not binging on feelings, but not restricting myself with feelings either. And so there's lots of balance examples that we can see with mental health and also recovery from addiction. And balance is so important in martial arts, because if I'm off balance, then I can be easily taken advantage of as far as if I'm sparring or if I'm in an actual fight.
Hmm. Mm. So, especially in old ages, which the martial arts was everything, there was nothing like facility that we have today, like gun or something. Martial arts were everything. You could, if they can use your emotions, they could use you against yourself. You are right. So,
hmm
what is one of the greatest challenges when dealing with addiction?
One of the greatest challenges I feel for folks that are dealing with addiction is dealing with shame, shame and guilt. And they're close cousins. Shame means I am bad, guilt being I did something bad. And so when it comes to addiction, the addiction wants to push someone to continuously feel that shame, to be engrossed in that shame, and to feel like they can never get better because they feel so shameful for what they've done. But thankfully, people are not their behaviors. The addiction is separate and apart from me, but the addiction wants someone to think that the addiction is at their core. And that's where the shame can reside. You can't do anything different. You can't change. Nothing's going to change for you for the better. And so I think that's a huge piece. And that can really disconnect someone from seeking the treatment, whether it's outpatient or inpatient, or just seeking out any support from family that they require.
Hmm. So why it would be a challenge? For example, is a shame something that is like addiction itself, or why people stick to it and cannot let go of it? What is like deepen connection of them with this addiction, with this shame?
I feel like people will continue in the addiction. It has these claws, the addiction has these claws, and that can be for escape from feelings, reward to an excessive level or finding relief, whether that's because of work or family affairs or stress. Could be because of uncertainty about something coming up. It could be to amp up a positive feeling. And so there's a lot of reasons that people keep coming back to it. It's like the inability to abstain despite negative consequences. And that would be another reason why people continue is a person usually will see like, wow, there's so many consequences happening to me, but I just cannot stop. It's cunning, baffling, and so powerful that way that I had this lack of behavioral control. There's an impairment in controlling my behaviors in a way that's healthy for me. I mean,
Hmm.
yeah. So if you want to use the jargon term, it's stress-induced hedonic dysfunction, which breaking that down means I have a problem with circuitry in my brain when it comes to pleasure with dopamine. And because of stress, I will seek out these substances or behaviors or toxic relationships for escape, reward, and or relief.
Hmm. So it can also be part of the self image that they can only see this inside themselves. Hmm.
Self-image is a big part of it. Like I will externalize image management, like I can't, it's hard to see inside myself because it's all about the external, all about maybe the drug or the person or the behavior. And what's lost is that authenticity of being able to know what I need from me authentically, my true self within me, because the addiction is in the way.
Hmm. Hmm. Sorry for much question in this regard because it is very interesting. And what about the self-esteem in this regard? What's the connection of self-esteem and how much it's important?
Yagalama, if we look at self-esteem as the reputation I have with myself, then the addiction will thwart that self-esteem. The addiction will crush it. The addiction will make me feel like I have a really bad reputation with myself. And so I feel unworthy. I feel unworthy to maybe have belonging with other people in my life that could potentially support me. Again, it goes back to that shame. And so that self-esteem piece is really important because without seeing that dial move a little bit over on the self-esteem spectrum, if you will, I am feeling lost. I'm feeling like I can't do anything for myself, or it's really hard.
Hmm. So the self-esteem is very lower with addicted people. Hmm.
Yeah, yeah, usually. Or there's grandiosity where someone puffs themselves up, yet really underneath the grandiosity, feeling superior to others, there is low self-esteem at the base, at the foundation. Yet people go usually one of two ways where with narcissism, it's elevated, they feel superior, they're on the pedestal, everybody else is below them. Yet often we see with people in addiction, it's low and they deflect with anger or manipulation or creating drama or justifying the use, those different deflections because that self-esteem is so damaged.
Hmm. Even in inferiority complexes sometimes. Hmm.
We can look at that as an inferiority complex, yeah.
Hmm. So, what are some of the treatments you use when working with people who have experienced trauma?
When it comes to trauma, I will often use what's called EMDR, which you may have heard of, eye movement desensitization reprocessing. Say that three times real fast. Yeah, it's a mouthful. And there's also accelerated resolution therapy, otherwise known as ART. Those both use eye movements. They're often quite nonverbal, and they start to shift someone at a deep level, whether it's EMDR, where they shift their cognitions from, let's say, I am unworthy to I am worthy with a particular memory, or when it comes to ART, it's shifting negative images to positive images in the brain. So the tagline of ART is keep the knowledge but lose the pain. So when there is a traumatic memory, the person is going to remember the memory, but it's going to be more positive. They're putting something different in, so it gives them relief. They don't have that traumatic memory at the forefront. It's put in the past where it belongs.
Hmm. So, what is a traumatic memory? Is it residing somewhere in the body? If so, if what's the experience of releasing them?
That's a big question. That's a very interesting question. When it comes to EMDR, somebody is taking, let's say, a memory that's been pervasive to them, that's causing them to have like hypervigilance or exaggerated startled response where someone might shut a door and then they shudder, they jolt. They might be having intrusive thoughts or images about that memory. So there's lots of different symptoms, signs that come with a traumatic memory. And so EMDR, we take that memory, we find out what's a core belief that's negative that attaches to that memory. So it could be, I am unsafe, let's say. And so with the treatment and the eye movements, desensitizing them to that particular memory, we're able to then install a positive cognition, such as I am safe in relation to that memory. So that's a very quick, that's a very quick answer to that question. There's 8 different phases to EMDR, and there's a lot of information with that.
Hmm. So that's interesting about the trauma because, as you said, it's very pervasive, and most of the people even don't know if they have a trauma or no. That's why I'm asking, like, there are different kinds of traumas like PTSD and many more, childhood. So, can you tell us, like, a few symptoms that if a person sees, they have to know that they might have a trauma?
Yeah, sure. Sure. Yeah. So, like I was mentioning, like the intrusive thoughts could be intrusive images that remind them of the trauma. It could be triggers. Like I knew someone that when the person saw really generally men like in a public vicinity, it was traumatic for that person. It was just generally men that triggered the person. It could be being in a certain place that reminds them of the trauma. It could be exaggerated startle response, could be the hypervigilance that comes. It could be even somatic concerns as well, like gastrointestinal issues, could be poor sleep as well. Nightmares can be part of that. Flashbacks can be part of that. And flashbacks are really nightmares when we're awake, if you want to really simplify what flashbacks are. Yeah, so there's quite a few symptoms.
So two more symptoms that I will ask as a quick response. The first one is the trauma live like longer until the old age, if they have in childhood or in youngster. It's the first question, and the second is if the trauma, if the fear is also a symptom of trauma, because somebody all of a sudden start fearing something, all of the work fear or from household, fear of loss of some loved one, fear of everything.
There is an elevated fear with trauma, the fear of losing perhaps someone that I'm connected to. Yes, because they are a big support to me. And yes, just general fear. Maybe it's fear of being in certain places in the environment. It could be fear of certain people. Yes, so fear is a big piece. And as far as you asking about, like, could there be, like, how long does the trauma last? It depends on the person. Like, it could be, like, the trauma could continue to be an impactful thing for them if they don't get treatment. It really depends on the person, what the trauma was, and what what their response is to the trauma itself. Now, if it's ongoing childhood abuse, then more than likely that can turn into complex trauma, and that can be chronic and ongoing unless there is treatment. Some people go through very overwhelming incidents and they can recover. So not everyone that goes through something really overwhelming has trauma. So it it really depends on the severity and a lot of different factors in the person's autobiography, like their biographical makeup and do they have a lot of protective factors? Like, is their family a good support for them? Were they able to have support? Were they able to be validated from the experience? Because that can add just insult to injury with trauma.
Hmm. Just one following question regarding to this. What do you think? Of course, if a person is traumatized or if they have any kind of trauma, they need to see some professional. But if they don't seek for professional, what is your advice for a person with traumatic experience, any kind of mindset or any kind of attitude or something which is generally for the general public, if they can keep that, they will be like healed with themselves, or at least they will not be much affected by it.
That's a very good question. I would say that if they do not seek any professional help, that they at least seek out online professional resources that are evidence-based, that have a strong backing with evidence, academic evidence, professional evidence, looking up different skills for mindfulness, different skills for grounding techniques is important. A really good website I'll just throw out to anybody listening is beautyafterbruises.org, I want to say. Don't quote me on it, but I think it's .org. So Beauty After Bruises has some really good blog articles on quite a few different ways to deal with flashbacks, ways to distract myself in an efficient way, and also how to ground myself in the present moment. So that's a few suggestions I would have if someone doesn't seek out professional help.
Thank you for that. So, what's your book about that's coming out? The Martial Arts of Recovery: How to Subdue Addiction and Achieve Mental Wellness.
Yeah.
Hmm.
Thanks for letting me speak about that. And I apologize, I gave you the wrong subtitle. So yeah, the martial art of recovery, self-mastery practices for subduing addiction and achieving mental wellness. And that book is all about the intersection of martial arts concepts with addiction and mental health treatment. So I take a bunch of martial arts concepts and techniques and I translate them over to help someone with mental health concerns like anxiety, trauma, and depression, and
Hmm.
also with addiction.
Hmm. Wow. So when we hopefully see that book.
Right now, May the 14th. Let's
Oh,
see.
good. Yeah, wow, that's a good news. So, what would you tell people coming into the field of mental health or addiction as a counselor, social worker, psychologist, etc.?
Anybody coming into the field, I would say be gentle on yourself. Give yourself some space. Allow yourself to make some mistakes. I mean, don't want that to be life-threatening for someone. However, nobody is perfect, and we can learn from those mistakes. We can grow from those mistakes. Being able to be vulnerable with even other people in the field that are there for support, reaching out for support, for consultations if need be. One piece to give to anyone coming into the field is self-compassion. Give yourself that self-compassion. The old saying, you're not going to get it by Thursday. In other
Mm,
words, it's a growing process in the profession of mental health.
mm,
And, I wish I mean, I do wish that what I knew what I knew now back then when I first started, yet it takes time to learn over the course of time. And so I would give those suggestions, that feedback to, you know, seek out support, take space for you, be kind to you, take breaks, enjoy life, have fun when you can. And I think that's good, advice for anybody.
Yeah, exactly. Uh, I saw some people after some traumatic or addiction process, they fell down from a very climax of success. So they badly want to go back there. As you said, now they need to go different way. So they need to be kind and gentle and slow, I think,
Galam,
because
yes, yes,
mm,
Galam, yes. I think calm, gentle, kind to them is going to be very important.
exactly. And I heard a very great quote that the easiest and the fastest way to achieve something is the slow way.
Yeah, I once heard this counselor say, if you want to go fast, go by yourself. Yet if you want to go far, go with others. So
Hmm.
I think that goes along with that quote.
Yeah, exactly. Working with others is the best trait that a person can develop. So, what role does hedonic rehabilitation play in addiction recovery?
Hedonic rehabilitation, yeah, that's like the big jargon term. That's not something that you would probably go to someone on the street and say, "Hey, how's your hedonic rehabilitation?" Yeah,
Mm,
so when it comes to recovery from addiction and also for mental health support, that means finding different ways to find pleasure other than seeking out substances or behaviors like gambling or workaholism or dysfunctional relationships.
mm,
So that's being able to research, being able to get curious about those different things that can give me pleasure, be fun with or without people, paddleboarding, skiing, traveling, being able to have board game nights, just it's finding those different ways to build a pleasure because someone coming into early recovery, the brain for such a long time was dependent on those substances or behaviors for the dopamine for pleasure. And now it's, oh, I'm not getting that pleasure from, like, say, cocaine. So what do I do? So the brain has to learn and has to recognize that there's different ways to obtain pleasure. And that's starting slow with this hedonic pleasure rehab, basically.
mm. What about the spirituality then? Does it play a role in recovery with mental health treatment or some other traumatic experiences or overall mental health?
I believe spirituality plays a major part, plays a major role. We
Mhm,
can look at spirituality with other terms like freedom, like
mhm,
humanity, liberation,
mhm,
loosening the chains that have been shackling me for a long time, whether it's depression or addiction or whatever that may be. So, and then spirituality is a lot more than religion. Religion can be part of spirituality. However, spirituality is all-encompassing, can be about values. Spirituality can be about meaning and purpose. And so I'm reclaiming my meaning and purpose. I'm aligning with my values. I'm also connecting with other people in my life, which is a really big part of spirituality. Spirituality is not done in a vacuum, it's done with other people. It's not something that I have to do isolated, nor does it need to be.
exactly. So, part of the spirituality that you do and you recommend it, I know you recommend it. So, what will be some practice of spirituality? As you said, overall concept and having a mindset of connection with others is true. But what are the some practices, daily disciplines that you recommend to people?
Prayer could be one, whether someone's religious or not. Meditation can be another for folks. Guided meditations, non-guided meditations, guided visualizations, which people can find on YouTube or elsewhere. They can do that as part of a group or by themselves. There's also contemplation, which is maybe contemplating on a particular topic. Being able to go out to nature, at least for me, even personally, is a big part of my spirituality. Getting out into the woods, sensory bathing, ecotherapy, lots of different names for that. Being able to touch the wood on the trees, being able to enjoy the stillness out in the natural environment.
Mm,
Music can be another big practice. Creating music could be drumming, could be playing my guitar, could be playing in a band. It could be listening to music out in nature as well, kind of, combining both.
mm,
And so there is quite a few different pieces we can look at with spirituality, even arts and crafts, different hobbies. Traveling can be a big part. Seeing different landscapes, hiking, again, going back to the wilderness, being able to find something larger than myself, perhaps,
mm.
whether that's the universe, God, whatever it might be.
Exactly. So, what about the contemplation you said? For example, uh, any topic of, of interest or anything that is that can help people with mental health, you recommend?
A topic for contemplation could be self-esteem. Another topic could be self-love or self-compassion. Another could be imagining others in my life and wishing them well.
Mm-hmm. So they should start imagining a good self-esteem and good self-picture, or maybe contemplate on different aspects of self-esteem.
Yes, yes. One of those aspects could be I'm doing my best right now and I'm forgetting the rest and just focusing on what I can do right now. Or it
Mm,
could be, even though I feel anxiety a lot of the times, I can get through this. I've gotten through this before and I can get through this. And so it's being able to find those mantras or find those positive coping statements and being able to, contemplate those, think about times when I was able to persevere, being able to see how that could look like in the future. Yeah, so
mm.
there's quite a few that could be done.
Exactly. Thank you for this much information. And please let us know where people can find you and how to get access to your work and book.
Sure. recoveryartscounseling.com, and that's Recovery Arts Counseling with two L since I'm up here in Canada. I know in the States it's one L. So that's my website. And then Instagram, Recovery Arts Counseling. Also Facebook, Recovery Arts Counseling, and LinkedIn as well. And my name, Eric Fisher, on LinkedIn is also. The book is, again, The Martial Art of Recovery, Self-Mastery Practices to Subdue Addiction and Achieve Mental Wellness. And that hopefully will come out in May the 14th.
And thank you so much, Eric, for your time and the service you do for others.
Thank you so much, Gulam, for having me on.